Hi, I'm Dr. Moshe Roth. I practice at Family Eye Care in Old Bridge, New Jersey. If you have headaches and migraines, we may be able to help you get relief using Syntonic Phototherapy and vision therapy. If you suffer from frequent headaches, you know how debilitating they can be. They just suck. They suck the energy out of you, they make you feel wasted, and they're painful, and they steal away your valuable time. If medications have not solved your problem, or if you don't like taking medication, then Syntonic Phototherapy may give you the relief that you're looking for. Headaches can be divided into two categories. Primary headaches. These are headaches that we can't find a reason for, such as migraine or cluster headaches. Primary means we don't have an answer as to what the cause is. Secondary headaches are headaches that we can link to something. For example, tension headaches or stress-related headaches. Some foods or medications can bring on a secondary headache. If you've had the flu or a cold, you might get a headache. Illness or infection, lack of sleep, dehydration, all of these can cause secondary headaches. Many tension headaches are caused by visual issues, like eye strain and focusing difficulties and poor eye teamwork. Many people who use computers, cell phones, and other small electronic media devices feel eye strain and headaches. Syntonic phototherapy treats imbalances between the two parts of the autonomic nervous system, the sympathetic nervous system and the parasympathetic nervous system. These two systems have to work in tandem. Syntonic phototherapy uses colored light filters that are specific for specific problems. These filters are personalized for each individual based on a number of diagnostic factors. We use certain filters for headaches and migraines. You may be able to see that here, this is a red colored filter, a yellow, a green filter. Different filters are used for different problems. Vision therapy treats imbalances of the visual system, either in inputting visual information, processing visual information, or in the motor output of where the two eyes are pointing. These show up as problems in eye teaming and tracking. Problems in vision can lead to headache. Solving the underlying problem can bring relief. In the same way that if you're looking up in the sky and you see a lot of black smoke, there's probably a fire that's producing that. So solving the underlying fire can solve the smoke, can solve the headaches and relieve the headaches. The first step is to find the source of the problem. Many people who have headaches realize that there's a vision problem at the root of it. The problem goes undetected and misdiagnosed because not all eye doctors look for and test for these problems. These problems are usually not detected in a general eye examination unless the eye doctors knows to look for these problems. Some eye doctors concentrate on the health of the eye itself, the eyeball, while some are experts in eye surgery or eye disease. The underlying reason for a vision-based headache is not a medical issue in the eye, but rather it's a functional problem of how the two eyes work or don't work together as a team. Some are brain-based problems. What kinds of vision problems lead to frequent headaches? Well, problems with binocularity, how the two eyes line up to produce one image. If you hold one palm toward you and one palm away from you, one is kind of like how you see out of one eye and the other how you see out of the other. When we look at a computer or read, what we have to do is we have to use the two together as a team. When these two line up, it produces one image. That's what should happen. But when somebody has difficulty in doing that and they have to expend extra energy and effort, then that can produce a headache. Physical focusing, meaning how we accommodate or how we physically focus. If our physical focusing system isn't working real well, that can bring on headaches. Convergence, divergence, and strabismus. Convergence means the ability to point the eyes in together as a team. Divergence is then bringing the two eyes so that they can point straight. Strabismus means one eye turns in relative to the other, or turns out relative to the other, or turns up relative to the other. A comprehensive eye examination that looks for more than just an eye health issue is able to identify these problems. For example, the tests have to include how the two eyes work to obtain one picture in the brain, and how they work as a team, both off at a distance and at near. In order to identify these problems, the doctor must test for near vision skills that are needed for reading and working on a computer. And that's much more than just testing each eye individually, but also looking at how the two work together as a team. Kind of like a husband and a wife who have to work together, a catcher and a pitcher, a quarterback and a receiver. They have to work together as a team. And if they don't work together as a team, then this team can't win. Once we've completed a vision evaluation and arrived at a diagnosis, we then can design a program of vision therapy to solve these problems. Vision therapy is different than physical therapy or occupational therapy, and it's specific to address the problems of the visual system. We prescribe a program that's problem-directed, using special equipment, lenses, prisms, filters, and computers. It's done in a specific logical sequence, similar to a curriculum that might be used when teaching a class, whether it's a third grade curriculum or a college physics curriculum. Vision therapy then gives somebody the tools and enables patients to learn how to use their eyes to work together. This then enhances vision and relieves headaches and other vision-related symptoms. In our office, we offer vision therapy in conjunction with Syntonic Phototherapy. Syntonic therapy has been used for over 100 years to treat eye conditions. Phototherapy balances the autonomic nervous system, which controls the perceptual visual field. Children with learning difficulties and adults under visual stress commonly have a reduced peripheral visual field, but they're unaware of it. Light enters the eyes, joins together at the brain centers to allow normal visual processing to happen. The retina, which is the back part of the eye, is actually part of the brain. And this is the reason that reaching the brain through the visual system is so effective. In phototherapy, specific colored lenses are worn based on the individual's problem. Typically, they're worn for about 20 minutes several times a week while looking at a full spectrum lamp. Wavelengths, meaning lens colors, range along the visual spectrum: red, orange, yellow, lime green, aqua green, dark blue, purple, etc. Each wavelength, and often combinations of wavelengths, are used to treat an assortment of visual problems. What problems can we improve with vision therapy and light therapy? They include headaches, migraines, convergence insufficiency, inability to point our eyes in enough, or convergence excess, meaning we point our eyes in too much, esotropia, meaning the eye turns in relative to the other, and exotropia, the eye turns out relative to the other. Vertical heterophoria means the eyes don't want to point together, or one eye always points up relative to the other. Reduced concentration and comprehension, dizziness and balance issues, and motion sickness. That's usually caused by a mismatch between the visual system and the vestibular, the balance system that's in the inner ear. Poor depth perception. That usually means that there's difficulty in using the two eyes together as a team to produce an image inside the brain of how that spatial awareness is. Emotional fatigue. What conditions cause headaches? Well, eye strain and fatigue can cause headaches. Dry, red, watery, or itchy eyes can cause headaches. Blurry vision, focusing and tracking difficulties, sensitivity to light, double vision, brain injuries such as a stroke, a concussion, or a traumatic brain injury like a car crash or a fall. If you have any of these problems, we can help. Call us at 732-679-2020. I'm Dr. Moshe Roth. I practice at Family Eye Care in Old Bridge, New Jersey. You can also look at our website, NJEyesight, NJEYESITE.com.